Hello, today I'm going to be talking very briefly about Guillain-Barre syndrome. Guillain-Barre syndrome describes a condition in which there is immune-mediated demyelination of the peripheral nervous system, and this is often triggered by an infection, classically Campylobacter jejuni infection. And later on in the course of this session, we'll be talking about diarrhea as one of the features of Guillain-Barre syndrome. Now, when you have your questions in the AKC exam, one of the major things that gives out the diagnosis as Guillain-Barre syndrome is when a patient has progressive symmetrical weakness of the lower limbs or legs, which ascends towards the chest. So you have a picture of a patient who first of all has lower limb weakness. Then there's an advancement of the weakness later on to involve the upper part of the body. In addition to this, there's also the reduction or loss of the deep tendon reflexes. Also, a few patients will have mild sensory disturbance. Other features that we need to mention about, we talked about the fact that Guillain-Barre syndrome is an ascending weakness of the muscles. Now, when Guillain-Barre syndrome hits the diaphragm, it is associated with respiratory muscle weakness. In addition to this, we could also have autonomic dysfunction with hypotension or hypertension and tachycardia. Both of these can occur. Then the other feature is gastroenteritis. Now, we have a lot of questions that paint the scenario of a patient who had diarrhea a couple of days back or 1 week back, then suddenly started having, and then progressively started having ascending weakness beginning from the lower limb. Okay, then it goes up. So if you can recognize these features, when we have this question in the exam, we will be able to answer it. Again, look for a patient who has history of diarrhea, then a couple of days after developed ascending weakness of the muscles. Now, how do we make a diagnosis? We can do nerve conduction tests, studies, stroke EMG, which shows decreased propagation of electrical impulses along the nerves. Okay. In addition to this, the CSF can also show increased protein and normal cell count. And the treatment is the use of IVIG and plasmapheresis. Thank you. So I will see you in my next discussion.